The impact of COVID-19 has been felt in almost, if not all, aspects of our daily lives. Various sectors of the economy are suffering from the challenges presented by this global pandemic, and the National Blood Service, which is the central blood bank of the country, is not immune to these challenges. The service appears to be one of the hardest hit as they fail to meet their monthly, weekly, and even daily target of blood distribution. A tour around the facility showed an urgent need of blood donation to salvage the situation. Only a few people were spotted at the facility, and their presence there was not for voluntary donation, but for family members who are in dire need of their blood. Here at the Blood Component Preparation Department, there were but a few bags of fresh frozen plasma waiting to be processed. In a room where processed blood is kept, there was nothing. No blood, the drawers were empty. The only pack of blood available are 37 bags of blood, which is on demand at the Korle Teaching Hospital, which ordinarily needs close to 250 units of blood daily. An official here tells me if the situation does not change, the blood bank cannot provide emergency blood distribution. Mr. David Ahiadro is the acting donor services manager at the center. He had this to say.
No, blood is only gotten from volunteers that willing to donors who are willing to do the donation. And then this volunteers that we're talking about, we have them clustered in panels. So with panel like the educational institutions, we do go to the second cycle institution, tertiary institution. Then the field days of life, we do go to churches or whatever. You and I know that with the onset of this COVID pandemic, there was a restriction on mass gathering. So that affected our collection base, which passed across. So what we are doing now is to engage in this appointment system where donors are called to come in to donate. So as and when the donors are free and they have the time to come and do the donation, they do come. So one does not get the needed inflows as it used to be before. So it's everywhere. So the situation at Bono is not different from what we are also experiencing here.
Okay. And how has that affected your business so far?
The effect goes directly to the patients, those who actually require blood for their management, which means that a lot of surgeries have to be postponed because of the fact that we don't have the needed blood to actually make sure that they are safe in case they might need the blood. Last month, which is June, we have done a total of 1,467 units. On a normal, on a very good day, we should have been doing around 3,600 there.
Wow.
So if we have done 1,460, so we realize that it's almost half of what we dropped by half.
50%.
Yeah.
According to him, some misconceptions, such as getting COVID-19 through the donations, has also contributed to the decline in the rate of donation.
There are a lot of misconceptions there. Even before COVID, people had misconceptions about blood donation, which calls for an enhanced and intensive education to actually disabuse the minds of people who actually have those misconceptions. So misconceptions, they do persist. But with the onset of COVID, it has added to the whole thing. Now people don't even want to go to the hospital, anything hospital. They don't want to hear anything hospital because of COVID, let alone come to hospital to do a blood donation. And so those are the challenges that we are facing. That's why we are also reaching out to the community this time around. Instead of telling people to even come here, we are trying as much as possible to locate designated collection sites within the community, so that we will be closer to the people to do the donations.
On the screening regimen, Mr. Ahiadro said due to COVID-19, donors are screened prior to donation to make sure they are not COVID carriers.
Since the inception of the COVID or the COVID pandemic, we introduced an extensive screening regimen, in the sense that aside of our normal screening regimen, we've added on to screen and make sure that the donors that we are actually getting are not COVID patients in the sense, or they are not COVID carriers. So we've actually expanded on our questionnaire, and we've also put in place the safety protocols to make sure that at least when we come, all the other protocols are observed and adhered to. So we have our thermometer buckets, we have our thermometer guns, hand sanitizers, and then the aseptic measures are further enhanced in the sense that one lies on the bed. When the person gets up, the bed is thoroughly disinfected in the presence of the person and the next person who is about to be lying down. So and the spacing too is enhanced. So as far as COVID preventive regimen is concerned, we have paused.
But the situation is not entirely hopeless. Kate's son is a senior nurse at the Blood Bank who has worked at the service for more than 10 years. She is donating to the bank for the first time in her life, and she shared her excitement.
I've been working with the National Blood Service for the past 10 years. And funny enough, anytime I try to donate, my HB is low, or one other reason, but mostly it's my HB. So since the pandemic, I decided I am going to do whatever it takes to make sure that my HB meets the level so that I'll be able to donate. So I think almost every 2 weeks I check my HB, and today I checked it, and by the grace of God, I have met the standard. So today I am donating my first ever blood to save a life, and I am so excited about it.
You look like you're so excited. Where's the excitement coming from?
You know, every time I try to encourage others to donate, it's a fulfilling thing to do. Most times people ask me, they're asking me to donate. What am I going to do? And I tell them, for me, if I am able to donate, and I know that this blood I'm donating is going to save a mother's life, a baby's life, the fact that I am saving someone's life is the best gift that I think I'm giving myself, that I'm giving another person the opportunity to live and to fulfill God's destiny for his or her life. For me, it's a rewarding something.